A week ago today, I vetoed House Bill 68. A week has gone on by, and I still feel just as firmly about that as I did that day. I believe that parents, not the government, should be making these very crucial medical decisions for the children. At that time, I also said that there are things we need to do to further protect children and adults. And some of these things that I announced that we needed to do go well beyond what is in House Bill 68. So 1 week later, I'm here to report on the progress that we've made on those items and talk about the things that we're doing to assure the quality and consistency of care for all patients, whether they are children or adults. First, I'm announcing that the Ohio Department of Health and the Ohio Department of Mental Health and Addiction Services today will be filing rules for public comment that, once effective, will provide protections for children and adults receiving care in this area from hospitals and clinics. Candidly, as I expressed a week ago, I am concerned that there could be fly-by-night providers, clinics that might be dispensing medication to adults with no counseling and no basic standards to assure quality care. With the rules that we are announcing today, that will take care of that. We need to ensure that adults as well as children are protected. These draft rules will be discussed at length with legislators and interested parties and will include the following. 1, the requirement of a multidisciplinary team to support an individual through care, including but not limited to an endocrinologist, a bioethicist, and a psychiatrist. Second, the requirement of a comprehensive care plan that includes sufficient informed consent from patients and parents, if we're dealing with a child, of the risk associated with treatment, and the requirement of comprehensive and lengthy mental health counseling prior to being considered for any other treatment. And let me just add that as I spent time looking at this and listening to people, it's clear that the most important part is the mental health counseling. It needs to be lengthy and it needs to be comprehensive. And I want to emphasize that. The second thing I'm announcing today is that the Ohio Department of Health will be filing rules today for public comment that, once effective, will require health care providers across the state of Ohio to report what's referred to as de-identified data that will be shared at an aggregate level on cases of gender dysphoria and subsequent treatments. In plain English, that means that no one will be able to look at the data and tell who it is. We do this all the time to protect privacy. The reporting of aggregate data occurs frequently in Ohio, from flu cases to causes of food poisoning to data on abortions. This data is used by policymakers, legislators, and the public so they can make informed decisions. Adding this rule will ensure that that is the case as well for the subject that we are discussing today. Third, I signed an executive order just a few moments ago enacting emergency rules that ban gender transition surgeries for minors at any hospital or ambulatory surgical facility in Ohio. This ban is effective immediately. Ohio law allows for emergency rules so that provisions important to public safety and other important public policy goals specified in statute can be put in place while the full rulemaking process proceeds. This will ensure that surgeries of this type on minors can never happen in Ohio. I know that's been one of the concerns that has been expressed. I've never disagreed with that. If we look at what evidence there is very little that is occurring, but let's make sure. And so that's what this does.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.